tomorrow is an important day. It's World TB Day. And while South Africa has made vast strides in reducing the number of TB-related deaths, tuberculosis still remains the top infectious killer in the world, claiming something in the region of over 4,500 lives a day. The University of Cape Town is striving to support the targets of the NTB strategy, and to that end, we're talking now to Professor Keertan Dheda, who is the Director of the Lung Infection and Immunity Unit at UCT. Professor, good afternoon to you and welcome. In a previous interview, you've been quoted as saying that the health risk posed by discharging patients with incurable XDR-TB is a major concern among doctors. You also go on to say that it's a ticking time bomb. Just how worried are you?
Yeah, thanks for having me on your show, and good day to the viewers. I think this highlights the bigger issue of drug-resistant TB in the country. Tomorrow is World TB Day, and this is an ancient disease that's far from eradicated. And the bigger concern now is that this bug has become resistant to the major classes of antibiotics. So South Africa probably has a burden close to 40,000 MDR-TB cases, of which we probably detect about 20,000 per year. And the drug-resistant TB has a very high mortality, and it's very expensive to treat. And many countries, including South Africa now, are spending almost 80% of their TB drug budgets on drug-resistant TB, which is not sustainable. So it is a major concern. One fraction of drug-resistant TB is what we call XDR-TB, or extensively drug-resistant TB. And the bug has evolved to a stage now where it's potentially incurable, even with the advent of some of the newer drugs that we have. So it is a very concerning situation, because drug-resistant TB on the whole has the capability of subverting TB control, both in South Africa and many other countries.
You also make, Professor, the very disturbing point that we're seeing an increasing number of cases of incurable TB and HIV colliding. What then is the consequence of that as it happens?
Well, I think people with HIV are exquisitely sensitive to getting tuberculosis, as they are to getting many other infections, because effectively HIV cripples the immune system. But I think the bigger issue is, the role of HIV in really fueling the TB problem in the country. I mean, TB now is the commonest cause of death in the country, has a massive impact on our GDP. And one of the biggest things we can do to try and control the TB problem is also to control HIV. And that means asking people to get themselves tested, adopting strategies like HIV self-testing, and for people to take their antiretrovirals or anti-HIV antibiotics so they are less susceptible to TB. I think that's the important public health message, that if we don't control HIV, we're not going to control TB.
Is that partly what you mean by coming up with better, and I quote, community-based containment strategies?
Yes, I think there are a number of angles to that. One thing that I want to emphasize, one particular point about community-based strategies, is this whole problem of trying to get not only drug-resistant TB and TB under control. And a big part of that is that we have the so-called missing cases. So about 30 to 40% of the total TB burden in this country, of almost 500,000 cases, remains undiagnosed and unreported, whether it's drug resistant or not. And this is a consequence of the way our healthcare system is set up. So we rely on people coming to healthcare facilities, and then we diagnose and treat them. But the reality is 95% of the transmission has already occurred. It's airborne transmission, it's person-to-person transmission, and that transmission has already occurred before people come to healthcare facilities. So something that I think we need to pay a lot more attention to, and we need to invest a lot more resources in, is going into the community and actively finding these TB cases. And that's even more critical for drug-resistant TB, because if we don't start doing that, we're never going to get on top of the TB problem.
And just finally, in spite of the situation that you've outlined for us, you're also fairly praiseworthy, are you not, of government's efforts in trying to contain the situation, notwithstanding the fact that a lot more needs to be done?
I totally agree. I think we have to strongly commend the Minister of Health, the Department of Health, and the government for a number of things that they have done. For example, there are new DNA-based state-of-the-art tests which have markedly improved the diagnosis not only of TB or drug-resistant TB. And we're very fortunate in this country. You can walk into any clinic in the country and readily get access to this test. In fact, I'm not aware of another country globally where this has been rolled out so effectively and so efficiently. The government has also made available through the Department of Health access to newer drugs like bedaquiline and delaminid, and repurposed ones like denezolid. And there's an ongoing commitment to fighting TB and educating healthcare workers, and a raft of other things, including the very comprehensive antiretroviral program we have and program to address HIV co-infection. So those are just some of the things. I think they've done a wonderful job, but of course a lot more needs to be done. And particular areas that I think where we need more focus is this active case finding, where in prisons, in mines, but in the community particularly, we need to go and actively find TB cases so that we can effectively try and control this disease. Of course, in parallel, one needs access to better tools, better diagnostics, better drugs. But the important thing is that the big driver of TB is poverty. And as you know, South Africa has one of the highest Gini indexes and inequality indices in the world. The poverty index has gone up, but that's not good news for TB. Overcrowding is a major issue because that drives the transmission of TB. And a lot of the transmission is happening in taxis, in buses, in congregate settings, in schools, in home affairs centers and so forth. And so that's another big area that we need to target to address this whole issue of finding these missing cases and the transmission of TB.
All right, thank you very much indeed. All ahead of World TB Day tomorrow. Professor Keertan Dheda, the Director of Lung Infection and Immunity at UCT.